Hello, my name is Dr. Dan Kahinka. I am an industrial organizational psychologist, and in this presentation, I want to give you a brief overview of psychology research, design, methodology, and statistical analysis. Today, what we are going to discuss is we'll first go through a little bit about topic selection. In the past, I've reviewed how topics need to be narrowed down. For this particular example, I'm just going to discuss more practical reasons why you might want to choose a topic. I'll also go through methodology, population and sampling, data collection process, including a review of some measures, and finally data analysis, which of course includes statistics, which everyone loves, and I will end with just a few brief comments about how you can finally present and publish your work. The topic selection, of course, is very important because you want to focus on your specialization, for one. As an example, I'm an industrial organizational psychologist, so I would focus on primarily psychology within the workplace, but of course there's many different areas that I could focus on. I could focus on everything from leadership and team development to addressing why people perhaps are engaged in their work, why maybe some have more stress than others. Some people get burned out, others do not. And then of course we can look at the various different populations of individuals that I could look at, which I will address shortly. First step of the process, what I would recommend is review articles. As an example there again, if I was interested in why people get burned out in the workplace, what I would start doing is reading some of the literature, at least reviewing over it. Maybe not reading entire articles, but I want to review over some information first just to get a better idea where my topic might be headed, whether it be for a literature review or actually all the way up to perhaps a research project. I always recommend that first review the abstract, the beginning of the article, and just see what that article is about. And that may draw some interest into a topic that you're interested in. And then look at the results in the discussion. See what the outcome of the study was and what maybe they discuss could be done in the future research. And that will help you also, develop your topic. Narrowing your topic, again, also consider something that you're interested in. This is kind of a basic thing to consider. However, you should be very interested in your topic. If you are not, particularly if you are performing research on a topic, it can be very challenging. You can be working on that subject matter for a long time, so you want to choose something that you're interested in. I know at times that it's not always possible. If you are, for instance, a student taking a class, you may be required to write about a topic, so that may not always happen. However, many times, even within a topic you are not necessarily interested in, at least do your best to try to find something that might draw your attention to certain subject matter and create some interest for you. What do you enjoy? So as an example, let's say you are taking a psychology history class. Maybe history of psychology, individuals that have developed the field does not necessarily interest you. However, maybe you are interested in critical thinking. Well, then perhaps if you're required in a paper to write about some individuals that are historical figures in the field of psychology, maybe you will add to that paper some critical thinking and try to figure out, for instance, how their views maybe you critically analyze them and how maybe they conflict, compare, contrast, are similar to contemporary psychologists, for instance. And then, of course, what are your goals? If you're working on a research project, what are your goals? And what I mean by that in a broad sense would be perhaps career goals. Where are you headed with your research? What do you want to use your research for? Do you have certain career aspirations or maybe personal reasons for conducting research? And then what are your goals with that? Are they to help you better understand maybe some personal issues that you're having, maybe personal type challenges that are occurring in your family or your community, so you want to learn more about that and better, so that way you know how to perhaps address those challenges yourself as a future psychologist. And it may be like, for instance, for myself, I may have some goals of helping people in the healthcare profession. That's one of my goals. So I look at various topics that are associated with healthcare workers: stress, spirituality, burnout, well-being, and then do research on that. Because some of my goals, once again, is to apply that research in the workplace, specifically in healthcare. And then finally, again, that focus of your study of your paper. Really refine down the topic. If you do not, it'll be too broad. It'll be unmanageable. And in the world of research and statistics and data analysis and population and sample selection and all of those, they have to be precise. Otherwise, you end up having, for instance, variables that are out of your control. Finally, literature review. You have to understand your topic in depth. You have to understand the various approaches to the topic, compare, contrast the information, synthesize the information, and that involves reading and reading and reading. Reading books, reading research articles, perhaps reviewing over different websites of organizations that specialize in your topic. Now, once you've chosen a topic, now you want to consider a variety of things that I would say it's not necessarily done in a linear manner. So while I will present you with some information here, it doesn't always go in this order. I must stress that a lot. So as an example, I am going to first discuss population, but as you're reading the literature, maybe you're looking at some different measures that you can use, because those measures may determine exactly what construct, what psychological construct or topic. Construct in the field of psychology can also be described as a basic definition would be something you cannot see, but is there. You can measure it. As an example, if someone has anxiety, you can't necessarily see anxiety. You can see some of the behavior, and you can measure that behavior so it's there, but you can't necessarily see a thing called anxiety. It's a construct. So as part of your investigation of your topic, you're looking at constructs, and to look at constructs, you want to make sure that they can be measured. And if they can be measured, then of course you got to start also considering, well, who am I going to measure this on? Where am I going to apply this? So these things do not always occur in a linear manner. Sometimes it's multiple things that you're looking at once. Here, however, we will talk about population. When considering your population, of course, that will depend on what field of psychology and what your specialization is. You can consider things like, as an example, psychological health. In my example of working with individuals in the healthcare industry, maybe I look at burnout, a psychological health problem. People are getting burned out. They have emotional exhaustion. They are depersonalizing. They are not looking at people as perhaps patients anymore. They're just numbers. And that's a serious psychological health concern. So I may start looking for people within the healthcare field, whether it be the doctors or nurses, or narrowing that down to perhaps nurses in a trauma center. So you can see we start looking at a general population. Population can also include, maybe it's geographic. Maybe it's within one country or a different country or a region of that country or a certain city. Profession, I've previously described that. I will again. So while I am currently looking at nurses, in the past I have looked at law enforcement. Other people may look at oh gosh, it ranges, you name it. I mean, it could include specific people in sales or marketing or distribution. It could include people in schools or universities or government organizations. So think about the various professions within those organizations, and there again, that becomes your population you're looking at. Health status, similar to psychological health, perhaps here we can consider health status as a more physiological health status. It may be that we are looking at individuals, let's say, that are veterans. Maybe they were in a war, in a conflict, and they lost limbs. And so we want to look at perhaps the psychological impact of that type of trauma. So we want to look at that population, which in the example I provided may be veterans of a certain conflict. Education level. Many times, whether we're looking at a certain group, educational group, other times we may be looking at, for instance, like something like veterans or nurses in my case, but also look at a demographic variable, which is a certain education status. College graduates, not college graduates, that sort of thing. We may also narrow down our population by looking at a certain business. I kind of mentioned this before, profession, maybe would be something more specific within that business. Here, perhaps we can look at, okay, is it a nonprofit organization? Is it a school? Is it a for-profit manufacturing facility? And on and on. Position and role. While you have certain businesses and certain professions, you also have certain positions and roles within them. It may be, for instance, you are looking at certain leadership characteristics. So you look at managers, or you are reviewing maybe frontline supervisors. Maybe you're looking at strictly people that are the primary leaders of an organization. The chief financial officer, the CEO, the board of directors. Teams, another population. Perhaps you're looking at team dynamics. So your teams become your population and you want to look at teams, and it could even be sports teams or something of that nature. And then finally, family. Maybe you look at families within a certain region, or families that, let's say, live in rural areas, families that live in urban areas, large urban areas, small towns, big cities. These different examples of populations that you want to investigate, these will be determined by the literature you read. As an example, the literature may state that you want to look at, let's say, a certain area of the world, geographic. You want to look at, again, nurses. We'll just use my example for sake. You want to look at nurses who are suffering from burnout, who have limited education, and are supervisors within the facilities they work. You see, so what I've done there is I've actually taken several of these categories that I've listed for you, and this is not all inclusive, there's many more, and I've taken several of those, and that becomes the population that I'm going to investigate. Now, once you have that population, once again, research is not necessarily done, at least parts of it, not in a linear manner, start to finish. Instead, go back and forth a little bit. So we will discuss sampling of that population in a moment, but for now, let's consider the overall methodology that we are going to pursue, because that also can help determine the sample. Because it may be that depending on the methodology we choose, there's a certain sample we may not be able to get based on one methodology, so we have to change to another. So again, we have to work on these things together. Quantitative research, something that I'm much more familiar with, because in the field of industrial organizational psychology, oftentimes we want to reveal certain quantitative evidence to support the evidence-based approaches that we use. So we a lot of times do quantitative research. However, qualitative research, very valuable, and I would almost say equally, because these two work, they work hand in hand. In other words, you have quantitative research to look at some of that empirical data, and then to better understand why, how, certain feelings, let's say, of workers, what have you, qualitative research is also necessary. The two go back and forth. Quantitative designs, very simply, again, I'll give you a brief review of some of these methods. There are more. In general, quantitative methods may include a correlational design. In other words, you're conducting some sort of survey, you have a couple measures and some demographics, and you want to see how certain variables get along, what their relationship is. As an example, when I looked at, in my last study, I looked at nurses and that relationship between spirituality, stress, and well-being. And it can be that sometimes that correlational relationship can go back and forth. Stress can impact well-being, and then in turn well-being can impact stress, back and forth. So there's no causation in this type of example. However, we're looking at correlations. We're looking at relationships. A quasi-experimental study, that may be done where perhaps for practical reasons you cannot perform an experiment. However, you can do a quasi-experimental study. As an example, I did a quasi-experimental study where I was looking at the impression consumers had over a certain announcement of an organization becoming more sustainable, more green-oriented. So in order to do a quasi-experimental study, and I could, for practical reasons, I could only do that online, I presented some information, provided something to influence that particular variable, and then did a post-test. So I did this quasi-experimental approach, and I was actually able to do it online. And then finally, an experimental study where you control your variables, you introduce another independent variable, and look at the outcomes. Here, of course, we can make claims of causation, that introducing that particular variable actually caused that effect. Now, qualitative research, we want to better understand why these things occur. In my example, why did higher levels of stress lead to lower levels of well-being among nurses? We want to understand why that may be. So now we may start, rather than using, let's say, a certain measure to measure levels of something, now instead we're interviewing people, we're talking to people, we're looking at some of the data maybe that they already have that's more qualitative in nature. So in other words, diarrhea counts. It may be that either, it may be a situation where certain workers have to provide some sort of notes on what they're doing, so it could sort of include that, which would also come under documents. Or they're actually given a diary and asked to every hour, for example, make comments on a certain particular thing that we're looking at, a certain construct that we're looking at. In-depth interviews. This may be where we select a certain sample of individuals and interview them with structured questions that we're asking everyone in a similar manner and trying to look now for patterns in what they're saying. We want to see why, for instance, nurses, as an example in my case, in my study, why when they had higher levels of spirituality, why that might result in lower levels of stress and higher levels of well-being. We know that that correlation already exists. Well, why is that? And in order to discover some of that, we need to do qualitative research and begin to ask these nurses. We can look at documents, like I previously mentioned. Documents may also include all sorts of different previously written materials that can be very valuable. And we can start doing some sort of content analysis and some of those things to look for certain patterns. Focus groups, we can bring a group of people together and ask them their experiences. We can ask them reasons why certain things are done and have a focus group discussion, which can be, for practical reasons, very effective, because now, let's say our time is limited. Well, now we can have maybe 10 people in a room versus only one at a time, like that may be done, let's say, for a case study. Our next example here, where a case study, we look at 1, 2, 5 individuals very closely, and here perhaps to some degree might be the real definition of qualitative research here, because we just really look very in depth at reasons of why, how, and really understand that particular construct that we are investigating among only a select few individuals. And then ethnography, where we are perhaps immersing ourselves within a certain culture to observe, to better understand, and keep in mind, perhaps we are using several of these techniques to do a more in-depth study. Now here again, I already mentioned some of these. I will go through them again just in some little bit more detail here and to give you further examples to better understand how these things can be done. So of these methodologies, quantitative research, we may have a correlational design where we administer a survey. That can be done online. It can be done in front of individuals. Let's say if there's a meeting in the workplace and we have 50 people in that meeting, we hand them all a survey they complete. Quasi-experimental research, as an example, it can be done online. It can be done within the workplace where you introduce maybe a certain training strategy and we observe some of the pre and post results with performance, a very common type of quasi-experimental study that's done because so often in the workplace we simply cannot control all those variables like we could in a laboratory, for instance. So experimental research in the workplace may be much more challenging, if not impossible. Therefore, the quasi-experimental approach can be very helpful, very useful. Experimental studies oftentimes need to be done in some sort of lab or a controlled environment. Many times is done with student volunteers, which actually is somewhat of a known limitation to many of the published studies that are out there because there is so much experimental research that's been done on students, which of course that now narrows down the focus of this research because that population is much more small. It's students. Qualitative research. Again, diary accounts. Maybe it's military veterans. Maybe they're overseas. They are being deployed. They are within a conflict zone and they are taking diary accounts of whatever it may be, levels of stress, family, how they're coping with being away from their families. All sorts of different constructs that can be investigated in topics. In-depth interviews, company leadership, for example. It could be that you are interviewing CEOs and individuals that are on a board of directors of large organizations or presidents of small companies. And you want to interview these individuals to find out whatever information that you're looking for. Documents could include student records in schools. Focus groups, again, I mentioned this previously, employees looking at certain behaviors and how they feel about certain things. Case studies, cancer patients. I have an acquaintance that has been working on very in-depth interviews. They're case studies, so a combination here, but it's of several people. So actually there can be some quantitative outcomes that'll come out of that. But he has been interviewing cancer patients and how they are able to cope with their cancer, their recovery, and even he's looking at rates of recovery. And then finally, ethnography. So for instance, Shaolin monks, we want to better understand that culture. We somehow get permission to immerse ourselves within that culture and observe and better understand what is occurring and perhaps develop some certain similarities that we see, some certain themes that are developed, whatever it may be. But in order to do that, in order to better understand that culture, which may be somewhat elusive, well, we get permission and we immerse ourselves actually within the culture. And then, of course, and I will address reliability and validity in a short time. But here's probably a good example. Once we immerse ourselves within a culture, that culture itself may start changing because we are being observed ourselves, right? So now all of a sudden we may have a reliability concern. So that's just a little bit of a preview of something else that must be considered as we are designing our study. And I wanted to bring that up again because, as I mentioned previously, many times this cannot be done in a linear manner. We are jumping back and forth between how we measure, the methodology we use, the population we're looking at, and then back to the sample to see what's practical and back to the measures. And that often occurs until finally that study is developed. Now, sampling strategies. I mentioned we will come back to this. There are many different types of sampling strategies. I'll go over them in somewhat detail in a moment here. I would encourage you to perhaps come back and review these and gain a better understanding of each of these sampling strategies, because here again, if you look at the sampling strategy, you may get ideas for that methodology. So then you back up and you change your methodology, and then as you're looking at the sampling strategy, you might start considering a different population that you're going to look at. That's how that kind of works. All right, so probability sampling, which is more randomized. We want to use this for perhaps experiments and even certain types of correlational studies. Simple random, stratified, systematic, cluster. There's some examples for you. We will go over those in greater detail in a moment. Just understand there's different ways that individuals can be selected randomly using these methods. Non-probability sampling, which is not random. It can be done out of convenience, which is very popular, especially for students, because they have access to a certain group of people, a certain population within a workplace, their school, wherever it may be. So convenient sampling, quota, judgment, and snowball. Snowball also very popular, particularly online, as we recruit participants, but then also ask those participants to recruit others. That snowball method can be highly effective. All right, what are these types of sampling methods? I do encourage you, again, here is where I said, maybe come back and look at these to better understand them. I will give you just a brief overview of each of these. Probability sampling, once again, on the left-hand column, you will see where it is more randomized, random sampling, versus on the right, non-probability sampling, where it is not randomized. You can have, let's just kind of scroll down here. You can have a simple random sampling approach where you simply select a certain number of participants, and maybe it's the first, third, fifth, sixth one, so on. And you just want to ensure that each of the subjects has an equal chance of becoming part of that sample. Convenience sampling, I already mentioned that. Maybe it's your local school, the mall, a certain characteristic of yourself, for instance. It may be a certain race, and you have access to other individuals within that race or that particular culture. Stratified random sampling, where smaller groups are selected from that overall group, versus quota sampling. Very similar, one structured, one not, where you are finding in the quota sampling a certain number of people in a certain group. So you see there's a similarity too. That's why these two are grouped together like this. Systematic sampling is you have a systematic process where you go through the sampling procedures and you perform subsequent observations using this constant interval between the samples that are taken. So again, this one here, and then a certain interval passes, and then this one here, and so on. Versus judgment sampling, where perhaps it's hand-picking individuals. Similar to the first, although that one's randomized, versus if you can't necessarily do a random sample because it's, again, in the workplace, well, now at least you can hand-pick individuals and recruit them perhaps that way. And to some degree, be able to develop this systematic approach, even though it's not random, you get close to it. And finally, cluster random sampling, where you're looking at certain natural groups of the entire population and you divide them within clusters and these certain groups, versus snowball sampling, which you can still do that to an extent. One is more randomized, snowball sampling is not, and snowball sampling, I would just suggest that within the measures that are being used, within that survey that's being used, that to the best of your ability, you are still controlling for that sample, for that overall, that population that you want to look at. You're somehow controlling for that. What I mean by that is, as an example, if you want a certain age group, well, you ask people for their age. What you might not want to do to improve your reliability is, say, if you do not fit within a certain age, you cannot take the survey, because then people may lie, they may fake their response, and they may take it anyways. However, if you ask for age and you do not make it into a sort of a big deal, a significant factor, then people may be more likely to actually put their age, and then from that group you select just that particular age group. So there's various methods that can be used in order to improve reliability and validity. Speaking of which, we're getting close to where I promised you we will look at that. Reliability and validity will definitely be applied as we're looking at our measures. So I'll talk about that again in great detail in a moment. But for now, as we dive into our specialization and what we want to measure, let's consider first off how many different fields of psychology there are. I want to give you a somewhat just a good idea here. You may be very surprised at how many resources are available to you, but consider this. You have in the American Psychological Association, so this is just in that one organization, you have all of these various specializations and 36 more. So in all of these categories, all right, keep that in mind. We'll just pick one. We'll pick clinical psychology. Now within the area of clinical psychology, you have a variety of clinical health diagnoses. Here are a few examples. Again, these are only a few. I could probably find many more if I looked harder, right? So you have all of these, and within each of these diagnoses, you then in turn have a variety of measures available to you. I just picked a few. For instance, cognitive therapy, addiction, anger, and anxiety. I just picked 4 of those. And you can already see within each of those how many measures there are. And again, this is not all inclusive. This is strictly looking at, for instance, measures that were designed in America. And many of these may be used worldwide and translated. However, consider in all the other countries that are doing research and are creating their own measures. So you have almost an endless list and an endless combination of specializations, particular areas within that specialization we're looking at, and then the measures that are used within that specialization. What's important is that we make sure we are measuring what's intended to measure. And that's our transition into validity and reliability. I promised you we would get to that, so here we are. So first off, very basic definitions. I will not go into all the different types of validity, all the different types of reliability, but let's just consider for this discussion validity as being the basic definition. Most basic definition would be measures are designed to measure what you want to measure. In other words, if you are trying to measure stress, it's designed to measure stress, and it actually measures stress. It doesn't measure something else. I have seen where measures are titled something, but then when I read the questions for the measure, I have significantly questioned what they were actually measuring. And if I would have been able to in these examples I'm thinking of, because I use those examples for critical thinking exercises with students, when I look at those examples, I know I could have done research further and basically proven they were not valid measures. So it's critical for you not just to look at the various numeric values, the statistics that are provided you that support validity and reliability, but also read those questions. Read the questions of the measures that you're using to just further make sure that that measure you select is actually measuring what you want to be measured. So that's kind of two things there. There's the internal values. Is it actually designed to measure what it's supposed to measure? And that's done with statistics to make sure it's doing that, as well as some other things. But then your personal interest in the topic. Is it really measuring what you want? And if not, you may have to search for a different measure that aligns with your topic. Reliability, a very simple definition of reliability would be that there's consistent outcomes when repeated under similar or same conditions. This graphic that I have for you here, that this is very kind of a very simplistic example of the definition or difference between reliability and validity, but it works. For instance, when looking at this target, we see where it's reliable and valid if not only it's hitting the target, which would be valid, but it's also hitting in that same place. That's reliability. If it's hitting all over the place, but still hitting the target, it may be valid, but it's not reliable. We're hitting all over the place. And then finally, it may be reliable. It is hitting in the same spot, but it's not valid. It's only in one area and not the entire thing that we are looking at. Okay, so again, that I think is just a very simple yet effective tool that you can use to better understand the basic definitions of reliability and validity. I believe you will remember them from now on using this just little example. Now the statistics. Many individuals are intimidated by statistics. However, they can be extremely rewarding. They do not have to be really, really difficult, as you will see. I'll just point out a few examples. So first off, some basic statistics would be frequency data, for instance. If we look at, let's say, a sample of nurses, and I have 200 nurses. That's part of my frequency output, 200 nurses. Maybe I also look at the type of nursing they do. So some other frequencies may include 50 nurses are in trauma centers, 50 are in rehabilitation, another 50 are somewhere else, and so on. So we look at some of the frequency data. Descriptive data, perhaps we can include here, for instance, is the sample evenly distributed? Is it for instance, if we are looking at a very basic example, might be IQ. People understand IQ. It has this bell curve, and most people are right here, they're average, and then it tapers down to the left with people that have lower IQs, and tapers down to the right with individuals that have much higher IQs. Okay, so we can use histograms and some of these other methods to look at some of that descriptive data of our sample. Now let's get into some more a different type of statistics here, where now we can really start looking at the results of our study and look at some of these relationships and you know, if it's a correlational study, start looking at some of our outcomes. And ANOVA, for instance, if you do, for instance, if you perform the procedures for a one-way ANOVA, now you can begin to start looking at differences between the averages of these groups. For instance, if you have, when I did my research, so I wanted to look at, for instance, people that had high, you know, if I had a high spirituality group, a moderate spirituality group, and a low spirituality group, then maybe I would look and see how those groups, the averages are related to average levels of stress, for instance. So I might use that, and it's very revealing. Correlation data, I even have a correlation scatter plot here to kind of show you visually what that means, and it's just looking at relationships. In the lower left here, you can see where there is a somewhat, to the trained eye, an obvious positive correlation. What I mean by that is, as people are measured, they're measured on one score, which is the x-axis on the bottom, and on the y-axis going up on the left there, that's another type of measure. Perhaps this is stress and well-being. So we can see here, and in this case, actually that's probably a very bad example, because as stress goes up, well-being should be going down, so that's probably a bad example. So maybe in this example, in my study, was spirituality and well-being. So as levels of spirituality went up, also did subjective well-being went up. And so what this represents in this matrix, in this scatter plot here, is all the different scores of our sample. So visually, we can clearly see this relationship. And then finally, we have regression, where now we can in turn, we can choose our independent and dependent variable, and then go from there and see how, if it's a simple regression, how perhaps a change in the one independent variable will result in a change in another dependent variable. And then, of course, multiple regression, where we start looking at multiple relationships, and it gets much more complicated there. Finally, I want to go over, once you've done all this analysis, so now you've chosen your methodology, you've chosen a population you want to look at, a sample you want to look at, the measures you're going to use, the type of methodology in order to collect the data, how you're going to do that. So you've completed all this methodology, you've collected all your data, you've analyzed all that data, you've written it all up. Now what do you do with it? Well, here are a few examples. I would just categorize the revealing the outcome of your data as either a presentation or publication. So let's just look at that. As an example, presentations may include academic conferences, for instance, where maybe you have some really instrumental research that you've done and you get invited as a keynote speaker. Perhaps it's a panel session where yourself and other professionals in your field are discussing this particular subject matter, or maybe even debating it. Maybe you have some research that conflicts with someone else that has different research, and so it's two different ideas, so you have a panel session on that. An oral session, strictly, you're presenting your information and then someone else comes up and now it's a new subject matter and so on. Poster session is kind of interesting. Many people outside of academia may never have heard of a poster session, but essentially you indeed create a poster, virtually, physically, and people are able to look at that, maybe read about some of your results, and then if you happen to be present there at that poster, then they might ask you some follow-up questions. It's a rather interesting type of way to get lots of research out there to a large group that may be mingling together. It's rather interesting. And then finally, a workshop. It may be that you're invited to some sort of academic or even organizational related workshop where you can now discuss your findings and then perhaps even begin to apply them in a certain setting. Professional conference could be similar to this, however, less academic, more professional. For example, I also put trade show on here, some similarities there, where actually you're presenting your work and then perhaps even to some extent, if it's a trade show, maybe even offering your services. If you have, let's say you specialize in a certain type of leadership training, so your research has been on leadership, maybe even on your training program, and you have evidence to support it works, that's your research, and now you're at a trade show where you want to sell that. You want to actually develop an income based on that research. And then all sorts of meetings, variety of meetings, whether it's with various organizations like nonprofit organizations or schools, could be different businesses where you're presenting your research, and various government institutions where you're presenting your findings. I do have that last on this list, but I'll just point out that radio, television, special events, other ways where you can present your research. I also put those at the end here because it may be that you first publish your research, then in turn you present it on radio, television, special event, or any of these others that I've already talked about. So, publishing, what does that mean? What does it mean to publish your work? Students that are in a doctoral program are typically published, but that may be their dissertation. That may be their research project, their thesis. It may be published online. It is not, however, published as any other type of manuscript that's maybe more refined, peer-reviewed, that sort of thing. Arguably, a dissertation and a thesis may be peer-reviewed because you have a committee, but then there's this extra level of peer review that's done in order to get in a publication. So that's what a peer-reviewed journal would be. A book, oftentimes, it may be written on your subject matter, so you become an expert in a field, so you write a book and include the research that you've done. A book could also include, for instance, a textbook, where the authors of that textbook use what you've already published in a peer-reviewed journal, and they use it in that book. Or maybe you're not published in a peer-reviewed journal, but you still get to be part of a book. Your research is perhaps a chapter on some of your findings. A trade publication, that may be more associated with a specific business. A magazine, sort of similar, where now but that may be more the general public just reading in an area of their interest, such as a magazine in healthcare, where it's not just nurses and doctors and pharmacists reading this magazine, but just people that are interested in the healthcare field. Newspapers, newsletters, blogs, websites, social media, all sorts of other areas that you can get your research out to the public for them to review. And And many of these, as you may have already figured out, are some are more difficult to get into, some are very easy to get into, and anywhere in between. So that is all I have for you today. And I say all I have, I mean, that was maybe a long presentation there, and we just covered the surface of some of these things. I guess the lesson to learn today is that there is a whole variety of subjects you can investigate. There's many different ways of investigating them, all sorts of methods and measures, and of course the statistics that are used to measure the data. And then finally, once you finish that project, get that information out there. You worked hard on that research, so get that information out there, whether it be on a website, all the way up to a high-level journal and anywhere in between. Thank you very much. This is Dr. Dan Kahinka, and I hope you have a very happy day.